Hi everyone, my name is Elle, and today I will be presenting adverse childhood experiences and coping strategies, identifying pathways to resilience in adulthood. So, here on this slide, we see what stress is when discussing emotions. So, we can define stress as physiological or psychological response to internal or external stressors. And stress can elicit different emotions and responses from people. So, next is ACEs and coping strategies. This is important because in the article, only two coping strategies were discussed: PF and AEF. PF is problem focused coping, and AEF is avoidant emotion focused coping. So, you can see that PF is concerned more with the resolving of the problem, where AEF is focused more on a way to resolve the negative response instead of the stressor. So, on this slide, I'm going to explain the research study a little bit. This is where it was hypothesized that AEF coping will be related to the increased psychiatric and physical problems, whereas PF is related with the decrease in those factors. So, you'll see different wave numbers. There are different participant pools. So, wave one is the original population. 10 years following that, the population decreased in wave two, and then 10 years after wave two came wave three, where the population didn't decreased again. So in wave one, the initial population was 7,108. Wave two had 4,963 participants. And in wave three, it was 3,294 participants. The participants ranged from ages 25 to 74, which is important to keep in mind about what life events are happening at those different stages. So, moving on, we're going to talk about what the research study did. So, this slide emphasizes that the researchers were measuring ACEs, coping methods, and health conditions. To measure the ACEs, the participants were asked a set of questions using the 7 dichomatosis categories. So, these included financial status, parental education, parental divorce, parental death, childhood emotional health, childhood physical health, and childhood sexual abuse. They then measured the different coping methods. So the researchers used the COPE inventory 4-point scale, which is a coping orientation basically just to see how people respond to stress. And this is when they also gauged to see if it was related to AEF coping or PF coping methods. So, for health conditions, the researchers asked the participants if they've experienced or have been treated for a list of the following diseases in the past 12 months. It was then followed with that large list, and it was mostly a self reflection study. So, here on this data from the study, it focuses on three categories discussed earlier. And in the top left, we have physical health. We can see that it focuses on a list of variables that cause an association with physical health to see if it's directly related or indirectly related with the significance level. So it's the exact same setup with the psych diagnosis in the bottom left and in the psych symptoms, which are in the top right. So now let's discuss the findings from the study. So for the physical health problems, we can see that the hypothesis was proven to be true. It showed that the ACEs were significantly related with more health problems, and the participants are using AEF more. It's also important to know that AEF levels are associated with chronic health conditions and diseases aside from anyone who has ACEs. So now moving forward, we're looking at the findings of the psychiatric problems and symptoms and disorders. So the ACEs were directly associated with the increase in diagnosis of psychiatric symptoms and disorders as well. This again shows that the AEF was the main coping strategy used, and it proves that the hypothesis is correct that the AEF is associated with an increase in psychiatric disorders and symptoms, proving that PF is the best coping strategy to use. So on this slide, I have a diagram showing the differences in significance with PF and AEF coping, especially when it comes to the outcome for health and different responses. It does show the significance levels, so please pause this if you need to take a better look at it. So as we wrap up the main content, the conclusion is that PF is better for your health physically and mentally. So being able to complete exercises is more beneficial. PF includes CBT and DBT types of therapies. So some common exercises are breathings, if then planning, cognitive reconstructing, meditation, and yoga. So thank you for following along. Here are the questions to consider. You only need to respond to one. The first one is how might two people with similar ACEs develop very different coping strategies? So what demographic factors can this relate to based on what questions the participants were asked about their childhood? And the second question is how hospitals can help doctors when they face a patient who has the same diseases as someone with an extreme stress from ACEs. So just explain an intervention or treatment which you find useful. Thank you for your time and attention. I look forward to reading and to responding to your answers. Have a great rest of your day.